Good morning, good morning. Thank you so much for joining us today for part 4 in the final installment of our myths and facts about children and COVID-19 vaccinations. So we are Mecklenburg County Public Health Department. Today we're going to be talking about kids and the COVID-19 vaccination. My name is Autumn Watson. I'm one of the senior health managers on the COVID-19 unit, responsible for outreach and engagement programs. I have a couple of my colleagues with me today that will be filtering your questions as we go along. I have Michelle Partridge-Doer. I have Darian Woods, our COVID-19 epidemiologist. I have Nelson Bolden, a COVID-19 health educator, and Brandy Foreman, a COVID-19 health educator. We are always available to answer your questions, so you can reach out to us Monday through Friday, 8 a.m. to 5 p.m. at 980-314-9400, option number 3 for English, and then option 8 for Spanish. If you reach us outside of those business hours, please feel free to leave a detailed message with your name, phone number, and a good time to call you back, and we will make sure that we return your call just as soon as we're back in the office. We are here for you and want to be able to get your questions answered and get you the information that you need in a timely manner. So moving forward, COVID-19 is over now. What more is there to prepare for? That's a quote that comes from a parent of a Mecklenburg County school system or Mecklenburg County charter school kindergartner. And this is a call that we received not too long ago in response to some of our COVID-19 messaging in children and vaccinations. So we will talk a little bit about that today and what that means. Today, we will cover the up-to-date COVID-19 statistics for kids in Mecklenburg County. We will cover COVID-19 in 2022, going into the 3rd year of a global pandemic, with good news. We will review main points from the doctors who are treating your kids every day, and then we will review our COVID-19 shot options. So right now, I'm going to pass this over to our COVID-19 epidemiologist, Darian Woods, for a review of what COVID-19 looks like for kids in our area right now.
Great. Well, hi, everyone. We have been receiving some good news throughout this past month, and actually a little bit longer, where our case counts have been going down for not only kids, but all Mecklenburg County residents. So we'll just take a look at the next slide. And so like I said, good news. We saw here in Mecklenburg County 152 cases among children in these past 2 weeks. And this is down 66% from the previous 2-week period. In all, children under 18 have accounted for 20% of our new cases. And to give that percentage some perspective, overall, their children represent about 23% of our total population. So we are seeing a slightly lower representation of children in our total cases. The graph down in the bottom right shows all the cases from the start of the school year, and this can really show how the past surge was the highest point in the pandemic, and it was quite greater than the Delta curve. But right now you see at the tail end of the curve, we're coming down and looking strong. So we have made some great reductions in the overall case counts for our population, and we are seeing some good numbers in the vaccination rates as well. So the next slide shows the vaccination rates for 5 to 11-year-olds as well as 12 to 17-year-olds. And among the 5 to 11-year-olds, we have roughly about 34% of them who have received their first dose, and roughly about 30% who have received their second dose and are now completed with their primary vaccine series. On the other hand, kids in Mecklenburg County who are between the age of 12 to 17, almost 60% of those have received their first dose. Overall, we are estimating, though, that around 100,000 kids aged 5 to 17 have not started the vaccination series. So we have some great opportunities to increase our efforts in Mecklenburg County to get our kids vaccinated. So I'll pass it back over to Autumn, who will continue with the presentation.
Awesome information. Thanks so much, Darian. All right, now that we know what's going on in our area with kids and COVID-19 vaccination, let's talk about COVID-19 as we move further into 2022. So is the pandemic over? Masks are gone? Cases are down? Why are some people still making such a big deal? Unfortunately, the pandemic is not over. The US and the world are continuing to see waves of new variants, hospitalizations, long-term illnesses, and death. But there is good news. Recent variants have caused less severe disease. It is true that more people have gotten sick because the newer variants are spreading from person to person faster. But the severity, which is how sick somebody gets, shows so far to be less than variants of 20 and 21. So back in 2020, before we had vaccinations and when we had our original COVID-19 illness that was taking hold across the world, people were getting very, very sick. We didn't have any tools in our toolbox of health to help combat this brand new novel virus. Throughout 2020 and 2021, we had the development of vaccinations, which have really helped equip our bodies and our toolboxes of things that we use to fight infection for fighting these new variants. We had the beta disease, we had several more along the Greek alphabet chain, and then last fall we did have Delta. Delta was severe and it did cause more people to get sicker. But as we have seen, Omicron is showing to make people less sick in general. And that is a good sign and good news from the pandemic standpoint. As we move through 2022, we have much more tools in our healthy toolbox within ourselves with vaccination and with better ability to fight off disease than we had just a couple of years ago, specific to COVID-19. So we also have more good news and some not so good news. The good news is people, including kids who get sick from these newer variants of COVID-19, are recovering faster. That means they're having to spend shorter times at home. And you guys have probably seen that the Centers for Disease Control and Protection have lessened the isolation period from 10 days to 5 days. And those individuals are being able to resume normal life much quicker than they were with earlier variants of COVID-19. The not so good news is that some people, including kids, especially those who are at higher risk, are still getting very sick from newer variants. They're staying sick for long amounts of time and even dying. Do we have any other good news? We do. Kids and adults who receive the COVID-19 vaccine and stay up to date on their boosters are less likely to develop severe disease or severe illness. They experience quicker recovery time if they do get infected with COVID-19. They get additional protection from future variants, those that we don't even know about yet because they haven't yet developed, and they have better protection from long-term complications that can happen from COVID-19. Sometimes those will be referred to as long COVID and can affect people for weeks, months, and even years after an initial COVID-19 exposure and illness. So that means you parents and kiddos and educators and caregivers should receive the COVID-19 vaccination and be sure to stay up to date with your boosters and who is eligible and recommended to get boosters at that point in time. So now that we know what's going on in our area with kiddos and COVID-19 right now, moving forward in 2020 with some good news, let's review some of the things covered in our webinar series from doctors who treat kids every day. What is the best way to protect kids now and in the future? The best kids to protect kids now and in the future is through COVID-19 vaccination. We will make sure that this video works when we project this up on our website, but it appears that the video with the pediatrician talking is not going to work for us today, despite testing this ahead of time. So the best way to protect kids now and in the future from COVID-19 is through COVID-19 vaccination. That goes for you too, parents. What about COVID-19 vaccine safety in kids? As you guys remember, a couple of webinar series back, we talked about the COVID-19 vaccine safety in general, and specifically if it's safe in some of our kiddos. You guys can reference back on our Mecklenburg County COVID-19 webpage at www.mecnc.gov/COVID-19, and you can navigate over to our parent and webinar page, our parent and caregiver page. In this area, you will find that we have linked up these presentations, and you can go back at any time to make sure that you can see the details on COVID-19 vaccine safety in kids and vaccination in general, how those came about, how the clinical trials have been conducted, and learn a little bit more about ongoing clinical trials to ensure safety moving forward. So will the shot affect my child's ability to have children in the future? That is still a question that we get quite a bit. And that was answered in webinar series part 3, which was just 2 weeks ago. All of the ingredients that are used in all of our vaccines in the United States, as well as the COVID-19 vaccination, have all been tested and shown not to affect fertility or children's ability to have children in the future as they grow into adults. In our series 2 weeks ago, we did show detailed information about some studies that have been conducted both in the United States, in Canada, and in overseas on COVID-19 vaccination and fertility rates in individuals who have been vaccinated, whether those individuals were vaccinated as an adolescent and have now grown into adults and they have decided to have children of their own, or in individuals who were adults and became pregnant either during the vaccine trial or after vaccine trials when they had already been vaccinated with COVID-19. So once again, to reiterate, the COVID-19 shot will not affect your child's ability to have children in the future. So what about vaccines in kids under the age 12? So vaccines in children under the age of 12 are safe, freely available in the United States, and the most important thing that you can do for your child to help combat COVID-19 illness and complications. Right now in the United States, vaccines are available through Pfizer for children ages 5 through 11 with regard to the category under 12. Boosters are not eligible, and we will review in just a second kind of what that looks like for our kiddos. So now that we know what's going on with kids in our area, moving forward in 2020 with some good news and main points from the doctors treating our kids, let's talk about the shots available to kids right now. And this will be a little bit of a review for you if you have been frequenting our webinar series for children and vaccines. You will note that this information is a review, and we want to make sure that you know this information and or know exactly where to come back and find it. So let's talk about the shots available to kids right now. So which COVID-19 shot does my child get? If your child is between the ages of 5 and 11 years old, right now they're eligible and recommended to get the Pfizer vaccination. They'll receive 2 doses total. And the dose is smaller than the dose that teens and adults get. Children with compromised immune systems, which makes them a little bit more at risk for severe complications from COVID, and it makes their bodies less likely to develop antibodies after the first 2 doses, may receive a total of 3 shots in order to get their bodies to start to build antibodies. If your child is between the ages of 12 and 17 years old, they are also recommended to get the Pfizer vaccine at this time. They will receive 2 doses to start. They receive the same dose as adults. Remember, through the clinical trials, we always try to go with the smallest dosage that makes the most impact. And for our kiddos that are 12 to 17 years old, that dosage is the same exact dosage as adults. Children with compromised immune systems may get 3 shots for their first series, just like our kids that are 5 to 11 years old. That's also just like our adults. Currently, right now, kids ages 12 to 17 years old are also recommended to get a booster shot after 5 months. So once they complete their initial series, 5 months later, they're recommended to get a Pfizer vaccine booster shot. Children with compromised immune systems may get a booster shot 5 months after their third shot. This means that those kiddos would end up getting 4 doses of the Pfizer vaccine in order to help their bodies build antibodies. So what is a primary series versus a booster? A primary series is an initial round of shots given 21 days apart. So this would be 2 shots for an individual with a normal immune system and 3 shots total for an individual that has a compromised immune system. Compromised immune systems can include things such as an organ transplant recipient or someone who is taking long-term steroids. A booster shot is a shot that's given 5 months after the initial round of shots. Right now, that's only approved for children who are 12 years and older. So what about my child who's under 5 years old? Well, so far, as of today, March 24th, 2022, kids under 5 years old are not authorized to receive a COVID-19 shot in the United States. There's trials that are continuing to happen right now to study safety for children younger than 5 years old, and we do expect to see some results from those trials coming out very soon. So now that we know what's going on with kids in our area, moving forward in 2022 with some good news and main points from doctors that are treating our kids, or in this case, it was Autumn telling you what doctors were going to say, the COVID-19 shot options for kids. There were some final words about COVID-19 shot and kids from Big Bird. So if any of you have seen Sesame Street, know that Big Bird, it's not going to play today, know that Big Bird receives the COVID-19 vaccination during one of the episodes of Sesame Street, and Big Bird's mommy talked to Big Bird about the COVID-19 vaccination and how Big Bird was feeling about that. So please stay tuned to our website to be able to see these short snippet videos that are less than 30 seconds. At this point, we will pause in our presentation and I will check to see if there are any questions that we can address live today. All right, right now I'm not seeing any questions, but health educators and Michelle and Darian, please let me know if we have any that pop up that do need to be addressed live, and I'm going to keep moving forward. So please, if you guys have questions after this presentation at any time, please do not hesitate to reach out to our hotline. We'll post that information up on the webinar again just as soon as we finish up. So this coming week, or over the next couple of weeks, you and your kiddos have upcoming vaccination opportunities at some of our local elementary schools. This coming Saturday on March 26th from 10 a.m. to 2 p.m. at Westerly Hills Academy, you can receive a COVID-19 vaccination or booster shot. From 10 a.m. to noon this coming Saturday over at Thomasboro Academy on Bradford Drive, if you're over in the 28208 area, you have a couple of options this weekend. Next week, starting on Monday, March 28th from 9 a.m. to 2 p.m., vaccinations and boosters will be available at Winding Springs Elementary School in the 28269 area. Wednesday, which is next Wednesday, March the 30th, in the 28203 zip code between 10 a.m. and 2 p.m., vaccinations will be available at the Marie G. Davis Middle School off Griffith Street. From 1 p.m. to 4 p.m., also next Wednesday, in the 28210 area, Smithfield Elementary School. Next Saturday, so 2 weeks from this, or a week from this coming Saturday, not this coming Saturday, but the following, from noon until 4 p.m., Huntersville Elementary School at 200 Gilead Road up on the north side of town, and another clinic from 9 a.m. to 1 p.m. for Blythe Elementary School at 12202 Hambright Road. So let me check back over and see if we have any questions today before we wrap up. It looks like we do have one. So parents are asking if their child gets a rapid test at school, will they still have to leave if they are saying the only symptom is a headache. So a positive rapid test at school does indicate infection, and they will have to leave and follow the CDC isolation protocol for individuals who test positive for COVID-19. Some of our schools are offering rapid tests regularly. Some are not offering rapid tests regularly from the school. So please be sure that you check with a school administrator. But if they test positive at school, they will have to go home. If they test negative at school, they will not have to follow the CDC isolation protocol for COVID-19. But your school may have a school health policy that would preclude them and make them go home for some other reason, depending on any other symptoms that they have. If the school nurse feels like they do have something that could be contagious to other children, that would be not COVID-19, they would definitely need to go home, but that would be the same for a stomach virus, for the flu, for anything that could be transmitted from child to child. So please be sure to talk with your school administrators. Great question. All right, if you guys have any more questions, please visit our website at mecnc.gov/COVID-19. You can also call us again on our Mecklenburg County COVID-19 hotline at 980-314-9400, option number 3. We do have a comment that's come in to note that Elizabeth Traditional Elementary is having a vaccine clinic on April 2nd from 10 a.m. to 2 p.m. So if you are in the area of Elizabeth Traditional Elementary, please visit that vaccine clinic on April 2nd from 10 to 2 if you are in need of a vaccination or booster. Lastly, I would like to pull my screen over here and just very quickly show you guys our website and how you can navigate to these webinar series. And additionally, if you would like to go back at a later time and pull up the slides and the recording from this series and view the videos from the pediatricians and from Big Bird. So this is our main COVID-19 site. You can get here by just going to mecnc.gov/COVID-19. And that will bring you right to this website. Right here, we have a section for parents and caregivers of children. If you click on that, you will see updates on vaccines for children. This is an area where we will put any updates that we get from CDC regarding vaccinations for children. So if vaccines get approved for children that are younger than 5, we will have this up here immediately in banners on our main page. Additionally, if there are any recommendations for additional boosters, as those come about, we will list those as well. We have information about vaccinations and kind of what to expect for your child. We have differentiation between the initial series, the 3rd dose and booster doses, school and child care safety, so all of the quarantine and isolation instructions, testing, treatments that are available for children, resources for you or your school. If you are an educator or you're a school administrator, or if you would like to print these and take them to daycare, however that looks for you, but different things to assist. We also have right down here at the bottom, recorded information sessions about COVID-19 vaccinations in children. So if you click on these videos, you can watch any of the prior vaccination series that we have done, part 1, part 2, or part 3. You can also get to the actual slides, both in English and in Spanish after the webinar series. After today, we will have the English and Spanish slides from webinar series part 3 that were currently being translated, and we will have webinar series part 4 listed up here as well, hopefully by the middle of next week. So you guys will start to see that. Please share with your schools. Please share it within your parent networks for anyone that you feel would get something out of our webinar series. With that said, thank you guys so much for today, and I hope that you have a wonderful rest of your week. Thank you.